Good morning, everyone. This is Kathy Cubit, and this is the LTSS MAC meeting. We will be starting at around 10 o'clock. Thank you. Good morning. This is Kathy Cubitt. I want to welcome everyone to August LTSS MAC meeting. I want to start off by saying this meeting is being recorded. Your participation in this meeting is your consent to being recorded. I'm going to shift because I can see that some of our members are still joining. So we're going to shift to the housekeeping committee rules item of the agenda, and then we'll circle back to the roll call and introductions. So this meeting is being conducted in person and as a webinar. To comply with logistical agreements, we will end promptly at 1. To avoid background noise, please keep your devices muted and the microphones off unless you are speaking. If you are attending the meeting in person, please keep background noise to an absolute minimum. This room is fitted with ceiling microphones that pick up everything. OLTL staff will report in-person attendance. Remote captioning is available at every meeting. The CART captioning link is on the agenda and in the chat. It is important for only one person to speak at a time. Please state your name before commenting and speak slowly and clearly so the captionist may capture conversations and identify speakers. Please keep your questions and comments concise to allow time for everyone to be heard. Webinar attendees may submit questions and comments in the questions box in GoToWebinar or use the raise hand feature to be put in queue to speak live. Those attending in person should use one of the microphones and wait to be called upon to speak. The tabletop microphone are reserved for committee members. Microphones are limited, so you may need to wait for OL staff to bring one to you. The general public should use the microphone sitting on the table at the rear of the committee tables. OLTL staff are available for assistance. Before speaking into a microphone, use the power switch on the top middle of the microphone body to turn the microphone on. The switch should be pushed towards the end of the microphone you speak into. When you are finished speaking, push the same button towards the bottom of the microphone body to turn the microphone off. Time is allowed on the meeting agenda for 2 public comment periods. If you have questions or comments that were not heard, please send them to the resource account email found at the bottom of the meeting agenda and on the LTSS Submac webpage. In the event of an emergency or evacuation, everyone must leave the building and assemble in the first responders plaza. OLTL staff will be available in the safe area in front of the elevators to provide any assistance. Please see the back of the agenda for more information. And with that, we will circle back to roll call, and I'll start with OLTL to announce who's present in the room.
Good morning, Kathy. This is Juliet Marcella. Subcommittee members present in the room are Allie Cronley, Michael Greer, Lloyd Wirtz, and then I also at the table to my left have Randy.
Welcome, everyone. And I'll read off who's with us virtually at this point. Anna Warheit, Kathy Bollinger, Cindy Seeley, Gail Weidman, Laura Wilmer Rodak, Linda Litton, Lynn Widener, Shell Garrett, Minta Livengood, Rebecca May Cole. I am expecting others who had said they will join, and I'll announce others. And Juliet, if you could do the same as folks entered the room. And with that, I'll turn the floor over to you for OLTL updates.
Thank you, Kathy. Again, this is Juliet Marcella, Deputy Secretary of the Office of Long-Term Living. Just have a couple updates for everyone this morning before we go into our presentation. Really excited to hear from the Department of Aging and their presentation on the PA Care Kit that will happen a little bit later on this morning. We go to the next slide, just on the agenda, the usual procurement updates. I'm going to talk about the HR1 bill or the OBA bill, and then just review a recent OLTL communication. So if we go to the next slide, there are no updates on procurement. Any questions can be sent to the procurement mailbox. The CHC RFA continues to be in a stay. If we can go to the next slide. On this slide, I'm going to go in a little bit of reverse order. I'm going to go through the communications and then go back to the budget and the bills. So the recent OLTL communications that I'd like to share this morning is the 2025 Nursing Facility Quality Incentive Program mid-year attendance list. July 15th, 2025, OLTL released a listserv about the 2025 Nursing Facility Quality Incentive Program. And this is a pay-for-performance incentive program, which has 6 quality measures, 5 clinical measures based on the minimum data set, and 1 utilization measure based on Medicare Part A claims data. So nursing facilities will earn points for meeting performance requirements for Medicaid services provided through the performance year, calendar year 2025. Points are awarded for achieving statewide benchmark goals and also can be achieved through incremental improvements. So please note that to be eligible for this incentive, the facility must be a Medicaid facility. They must have achieved a median or better performance on at least one of the 6 measures previously talked about, and have attended at least 1 long-term care learning network webinar hosted by the Jewish Healthcare Foundation. So if you do not attend one of those learning network webinars in 2025, we do not have makeup sessions. So if you don't attend, your facility is not eligible. So if you have any questions regarding attendance or the attestation form for submission, please send them to the resource account RA-PWNSLNATTEST@pa.gov. We go to the next slide. So the Pennsylvania Long-Term Care Learning Network, on July 25th, 2025, we shared a listserv for an upcoming Long-Term Care Learning Network webinar. It's an invitation for the August 7th, 2025 learning session, which is held from 2 p.m. to 3 p.m. This upcoming webinar topic is Pennsylvania's MDS updates and the transition to the patient-driven payment model, or PDPM, for the case mix and other October updates. So for our nursing facility partners, really do encourage you to attend this learning webinar. Because the focus will be on the nursing facility regulations and additional information beyond that, particularly the changes in the upcoming MA processes, field operations review teams, and the supporting documentation. Again, reviewing the MDS changes that will be in effect October 2025, and walking through the MDS audits that will also begin in the fall of 2025. So those are the OLTL communications, and I'm going to use the rest of the time to share a little bit about the budget and the bills. So you can go to the next slide, and we'll just stay there for the duration. So I'm going to give an update on where we are with the state budget. In regards to the state budget, I'm sure you're aware that the General Assembly has not yet enacted the 2025-2026 budget into law. So the governor continues to negotiate with leaders on how to finalize that budget. And the Office of the Budget has put steps in place to enable the Commonwealth to meet its legal obligations, to fund the mandated programs and provide for the welfare of residents. So examples of those programs are the Medical Assistance Program, Food and Drug for Assisted Facilities, agency buy-ins, and child care subsidies. So that's what I have for the state budget update. We've been in this position before, so it's something we weather through, and hopefully they will come to a resolution soon. So let's talk about the federal budget reconciliation and the HR1 or the OB3. So, many of you probably have been aware by now that there have been some significant changes to some critical programs that affect over 3 million Pennsylvanians. significant changes to the SNAP program in particular, and the Medicaid program with a special focus on the Medicaid expansion population. So I'm going to focus on the Medicaid program because that's what we do here. Some of you may have heard Deputy Secretary Kozak and others speak at the MAC meeting about the SNAP impact. If you haven't, I do recommend that you review those notes because a lot of valuable information was shared. So for the Medicaid program, which is a life-saving program, it provides coverage for, as I mentioned, about 3 million Pennsylvanians, which includes 1.3 million children, about 423,000 individuals with disabilities, 312,000 older adults, and nearly 10,000 veterans. We believe that the federal cuts will take over 310,000 Pennsylvanians off of their health care. We believe it will raise healthcare costs across the board and potentially threaten the closure of at least 25 rural hospitals. In other words, the cuts to the Medicaid program will have a devastating impact on the Commonwealth, its economy, and residents. So the first provision is the work requirements. And we estimate about 200,000 individuals may lose coverage because of the new work reporting requirements that individuals ages 19 to 64 will be required to report on and do, which includes engaging in work or community service or other volunteerism for at least 80 hours per month. So that's pretty significant change. In addition, it has significant administrative burdens that go along with it. We estimate that about 110,000 citizens are at risk of losing their coverage because of the administrative burden that comes with the biannual or twice yearly eligibility redetermination. So for us at the Office of Long-Term Living, that change in particular is most concerning to us because we know the challenges that come with redetermination. So that is one of our special focuses. These two changes will take effect January 1st, 2027. So that is what we are gearing up and preparing for. And, you know, in making these requirements the law, it also imposed federal mandates on Pennsylvania without any flexibility. Okay? So we estimate that to redetermine eligibility every 6 months instead of annually, the department will need to increase our staff by about 500 people. That said, that's an estimated additional cost of about $37 million per year. Implementing the work reporting requirements would require an increase of about 250 people, with an estimated cost of an additional $18 million per year. So that is going to be an impact on the entire Medicaid program and the Department of Human Services looking forward to 2027. So in addition, we are also have to alter how we fund the Medicaid program with other changes that were put into the HR 1 bill. In particular, there are two provider taxes that will start in fiscal year 28-29 that are estimated to cut more than $20 million from our Medicaid-funded programs over the next 10 years. So for those that aren't familiar, we did talk about them in prior meetings. The provider taxes that we're talking about today are particularly funded by hospitals and health plans. And other, critical providers. The nursing facility providers were carved out as we anticipated. So this is going to have a critical impact to our Medicaid program with those funding cuts that then have a ripple effect to hospitals, to health plans, to commercial insurance plans. So it doesn't just impact individuals who utilize Medicaid, it will impact every Pennsylvanian. So, and a lot of that, you know, a lot of our concern is also with our hospital systems, because as many of you know, they're legally required to provide care regardless of the ability to pay. And that's, you know, where we get significant ripple effects of longer waiting times, potentially, longer waits in the emergency room. And it does particularly impact our rural hospitals because of, you know, the current nature of their work and their costs, and greater rates of uncompensated care in their emergency rooms. So that is sort of the crux of the impact that we're anticipating currently between HR 1 and OB3 or OBA. And so I wanted to share that and talk about that and share that with you today. So, you know, part of the discussion for the justification for HR 1 and OB3 was they're trying to cut out fraud, waste, and abuse within the Medicaid system. And certainly while there is fraud, waste, and abuse, I have to say Pennsylvania's program to make sure that we apply the Medicaid program with integrity is one of the best in the nation. So we do an excellent job in Pennsylvania weeding out, following through with, and cutting down fraud, waste, and abuse. We rank number 1 in the Medicaid fraud charges and overall with the overall convictions that we secure. And that is possible because of the hard work within our program integrity offices. It's because of the diligence of our partners and our community organizations and everyone who cares about the Medicaid program and making sure we implement it well. So we hope that as we move through the next couple of years, when we start really feeling the impact of the HR 1 and OB3, we'll be looking to the LTSS subcommittee in addition to the other Medicaid subcommittees and the MAC to come together to provide, you know, your advice, your experience, your thoughts as we face some particularly challenging years. Again, we are currently focused on the impact of 2027 because, as you know, 2028, while it will approach quickly, a lot can happen between now and 2028, and some very significant political events that happen. We do encourage everyone to continue your education, your advocacy, and your good and hard work across the nation with our local representatives and in particular our federal representatives. And I know a lot of you have been doing really Herculean efforts in educating about the importance of the Medicaid program, and I just urge you to continue that great work. So I'll pause here if there's any questions.
Thanks, Juliet. There's a question in the chat from Anna Warhite. Could you clarify the provider tax changes estimation again? She didn't quite catch the number.
Let me go back to my notes here. I believe it was estimated more than 20 million. I don't have an exact number for you, Anna, but thank you for that question.
Thank you. And before we take more questions, I do have a number of members to announce who have joined us virtually. Carol Morfisi, Juanita Gray, Leslie Gilman, Matt Seeley, Ryan Schofield for Michael Galvin, and Bridget Lowry's in for Monica Vaccaro until around 11. Ham Walls, and Patty Pinella Duckett. Is there anyone virtually who has not been announced?
Good morning, Kathy. This is Neil Brady. I'm present.
Oh, thank you. Sorry I missed you. And Juliet, has anyone else joined from the room?
No, Kathy, no one has joined from the room.
Thank you. I have a quick question and we'll open it up. On the nursing home slide, number 6, you mentioned about changes to the MA process. Is that all related to HR1 or is there other changes that are coming?
No, those changes are related predominantly to the transition from the old case mix data element, the RUGs, that is transitioning over to the new case mix data element, the PDPM. So it's a state regulatory change.
Thank you for that clarification.
Yep.
Other questions for Juliet at this time? We'll start with the room.
There are no subcommittee member questions, but there is a question from Shauna.
Okay, we'll wait for we'll wait for members virtually to go first, and then we'll go to Shauna.
Okay.
Any of the members virtually that have questions for Juliet? Okay, Shauna, the floor is yours.
Can you all hear me?
Yes, we can hear you.
Okay. I'm only asking because I was in DC a couple weeks ago and I had a couple conversations with various legislative members and was told that the work requirements will not affect people with disabilities. I don't know whether to believe them. In fact, I'm very suspicious, but I mean, I'm working to set up volunteer programs at my SIL so that people have things that they can volunteer to do so that counts. But I'm just curious as to what, if anything, you may have heard about that.
Yeah, so looking at the bill and the language, they do make reference to how it will not impact individuals who are 65 years and older or who are, I think the exact phrasing was medically frail. So we don't anticipate that there would be significant impact in the Office of Long-Term Living LTSS programs. While certainly we're looking at that, we're also, looking for additional interpretation and technical assistance that's coming out. But for the purposes of the Office of Long-Term Living, we anticipate that if there is impact, it would be minimal. And we don't anticipate it impacting anyone who meets the criteria for nursing facility clinical eligibility. So that's helpful.
Thanks.
Yeah, but again, we have to wait for that additional technical assistance. Kathy, I don't see any other questions from the room.
Okay, thank you. Since we have a little bit of time, I actually had a question. Juliet, do you know if the state's looking at any of the no wrongdoer medicative administration claiming options to help with some of the, I know you talked about a lot of the staffing needs to implement this, and I know that's an option for states to consider. I didn't know if Pennsylvania was looking at that.
I don't know what the camera's on, but it's on. It's just that they're putting all this stuff
So,
on.
Karen, I'm gonna mute. Okay, thank you. Just to cut down on the background noise. So apologies for that. So, we are evaluating all the options that are available, but I don't have anything that I can say concretely at this point, Kathy.
Thank you. Are there any other questions from the members virtually?
Um, I, I do, yeah. This is Carol Murphy. As far as the work eligibility, I used to work full time and I retired, but I'm working a little bit part time virtually. What is the limit that I could make and maintain my waiver?
That's a great question, Carol. Let me make sure if I heard you correctly. The question is, how much can I work and maintain my current Medicaid benefits? Is that the question?
Yes.
Okay. So, to maintain your Medicaid eligibility, there is a financial requirement to maintain that Medicaid eligibility for the waiver services. In our waiver programs, we do 300% of the federal poverty limit. I don't know exactly what that number is. We will post that as a follow-up. However, that being said, I'm going to take the opportunity to highlight medical assistance for workers with disabilities. That's an incredible way to work and maintain financial eligibility for Medicaid benefits. In addition, I'd like to highlight the Social Security Administration Ticket to Work program that also provides assistance for individuals with disabilities to work and have gainful employment, do trial work periods, test things out, transition to employment. I encourage folks to consider that. In addition, our great partners at the Office of Vocational Rehabilitation would give supports to individuals interested in working or even, volunteering and experience different work activities towards competitive employment. I would highlight the Pennsylvania ABLE accounts and the ability for individuals who are working, who acquired or had a developmental disability before the age of 24, I believe, to be able to open those accounts and, put their savings in there for their current or future health-related needs. So there's a wide variety of very successful ways that individuals with disabilities within our programs can work and continue to receive benefits. In addition, we have the Act 150 program that serves over 1,000 individuals in Pennsylvania who work, who may still access personal assistance services and the personal emergency response system services and financial management services for participant self-directed services, and work and access those services at a sliding scale. So I hope that answers your question, Carol. I'm sorry I don't have the exact amount at the top of my head.
You may not know because nobody seems to know. If they combine the waiver with my low income status, because I live in a low income building, does that change?
So, Carol, I'm going to ask one of my team members to follow up on that particular question, only because it seems to be particularly pertinent to an individual situation. So I'm going to ask Randy to have one of his enrollment team members reach out to you to answer that question directly after this meeting. Would that be okay with you?
What would be their name? What name was that? What should I be looking for? What is the name of the person?
Are you asking for the name of the individual who will reach out to you?
Yeah.
I don't know who that would be, Carol, but I have your email, so we'll make sure that you have the name and the number and the email of that person, okay?
Okay, thank you.
You're welcome.
Thanks, Carol and Julie.
Sorry.
Go ahead.
One last thing, Kathy, and I'm a little embarrassed that I left this out. For folks who are in the waiver services program, want to highlight benefits counseling that can help folks. My team is laughing at me because they saw the realization on my face. But yes, benefits counseling is a great service to allow folks to take a look at their income. It's especially beneficial as folks are thinking about going to work, building of that financial plan, learning about the impact, potential impact or no impact to all of their benefits, which includes other services and benefits outside of the Medicaid program, like, their supportive housing and things of that nature. So I did want to highlight that benefits counseling service available in our waiver program. Sorry, Kathy, back to you.
Oh, no worries. Thanks, Juliet. Before we start the public comment period, I did want to follow up with, at our last meeting, we discussed about the importance of getting a letter out to increase personal assistance service rates for CHC participants. I want to thank Shona Eakin for drafting a letter that was circulated among members. I received received approval from a majority of members to send that letter. The letter was sent on Friday, July 18th to Governor Shapiro and various other key state officials and key chairs of different committees, including appropriations and Health and Human Services in both chambers. So we did not receive any official response to the letter, but it really was more to express the importance of that, making a request that there be a 10% increase for this fiscal year for all direct care workers in CHC. But again, if anyone wants that letter, you can let me know and I can email that to you. I don't know, Shona, if there was anything you wanted to comment on before we moved on officially to the public comment period.
I have nothing to say except thank you for asking me to do that, and I'm glad we got it sent to the governor.
Thanks again. And with that, we'll move on to the public comment period. I guess let's start now with anything in the chat from the general audience. I'm not sure if any hands are raised. It doesn't look so from my end.
So, Kathy, just to pause a moment, Lloyd would like to have a question or comment.
That's true. Lloyd Wirtz,
Okay.
behavioral health advocate from Psychiatric Leadership Council and Family Training and Advocacy. Since a lot of the information that we receive from the federal level regarding the House Resolution 1 seems to come from the titular head who likes to think he was responsible for it, and since he's speaking to minions who have no idea of what it is that we do with these funds in the community, it seems to me, and no idea of the names of those individuals either, it seems to me we might benefit from having a public exposure to some of those federal officials or legislators. And I don't know if that's ever done at either a MAC or an LTSS subcommittee meeting, but it wouldn't be a bad idea to have some of those folks come here and make sure our membership is aware of that, so that they can see the people that they're impacting. These aren't numbers on a board. They're individuals who are trying to live lives at some level that can be independent and deliver the quality that they experience on a pretty much assumed level on a daily basis in Washington. I don't know if that can happen, but if I can be helpful in that in any way, I would be happy to do so.
Thanks for the comment, Lloyd. I think that's a little beyond what, even this letter was a little outside of the scope of the committee, but I know there are various organizations doing just that. But anyway, thank you for that input. Is there anything else from the room or?
Sorry, Shauna has another comment.
Go ahead.
I have two comments. Lloyd, my experience when I went to DC is that, and I've been trying for 7 months to get face-to-face meetings with federal legislators and have only been successful with Fetterman. Otherwise, we can't even get an appointment with staff. So that's one comment. And then Juliet, this next one is directed to you. I don't know if you know the answer, but I'm worried about Act 150. Personally, professionally, I'm worried about Act 150. And with all of these potential cuts, how likely are we to lose it?
So you're absolutely right. I don't have an answer. What I can say is, DHS is committed to our mission, and we recognize the importance of the Act 150 program. We're an employment-first state. It doesn't make sense for us to cut a program like that helps individuals stay in the community. But we don't have a state budget. I don't know what the numbers look like. It's not on the table or in my thoughts or DHS's thoughts to end that program. That's kind of all the comfort I can give you. Yeah, sorry.
I'm sorry, was someone about to speak?
I was going to continue to say that I think the Act 150 program is a great underutilized, unknown program. So in my previous asks about education, I would ask folks to, continue to educate about the worth of that program for the over 1,000 Pennsylvanians who rely on it.
Thank you. Okay, we
Kathy,
still have a little. Go ahead.
This is Neil Brady. I wanted to ask Shauna a question just regarding her sharing that she's had difficult time getting meetings in Washington, D.C. What has been the experience? Have you not had acknowledgement of your request, or have you had pushback?
We have emailed, phone called, and showed up in person to attempt to get a meeting with Senator McCormick and some others, and we get told that he's not meeting with anyone until after the budget is passed.
And anything congressionally that you could share?
I don't quite know how to answer that question. All I can say is that we're trying hard to get the people receiving services in front of the people that are making the decisions, and they're not making that easy.
Thank you.
Are there other, it looks like Bridget has her hand up. Bridget, did you want to unmute and speak?
Yeah, I'm just curious, Juliet, if the number of people that you anticipate could be dropped as part of the revalidation includes the individuals with cognitive deficits who may not be able to attend to or fill out the revalidation paperwork um, that's going to be needed on now twice a year instead of just once a year.
Yeah, Bridget, thank you for your comment and your question. As we've seen with the public health emergency unwinding and redeterminations, we've seen a couple of things. We do see some individuals struggle, and we recognize, and that's kind of where we get our estimate from is from our experience with the public health emergency unwinding. However, that being said, the Office of Long-Term Living and our teams have had discussions with our managed care organization partners who did, I have to say, a really, really good job through the public health emergency unwinding, working with their provider partners, working with community-based organizations, working with service coordinators to provide assistance to their members, particularly the members in the LTSS population, to help them with that redetermination process. It is also part of the foundation of the benefit support services that we implemented this past year with the Pennsylvania Independent Enrollment Broker to provide some additional one-to-one support. To help individuals with the Medicaid program, with their applications, with complaints, with connecting with other community providers and supports like free legal aid. So we are working and doing as much as we can to ensure that individuals who are eligible for Medicaid maintain that eligibility because that's what we want. We want Pennsylvanians who need services receive those services, especially if they're eligible for those services. Now, that being said, there's a couple of things. One of the things that I will highlight for folks is the Department of Human Services Office of Income Maintenance has also begun the pink envelopes. So redeterminations, communications come out in pink envelopes to further distinguish them from the piles of potential mail that get delivered to our offices. So we ask everyone to join that pink campaign, alert individuals that if there's a pink envelope with a keystone on it, that they should most definitely open it. In addition, as you heard me mention prior, we also brought online the expanded phone support and capabilities for long-term services and supports that wasn't previously available because of the complexity of LTSS applications. So that's also further expanded to help provide additional services and supports. We continually look to improve, Bridget. So we will, most certainly rely on you and our advocates to continue to provide suggestions and ideas. Certainly, Shauna, if you ever get that federal partnership, you could suggest that there's certain exemptions for our LTSS populations. So a lot of work to do, but a lot of great foundations and efforts and lessons learned already in place. I hope that helps.
Thank you.
Thank you. Let's move on now to give the general audience, the general remote audience a chance. Is there anything in the chat or I don't know if there's a hand raised, but anything from the general audience? And then Matt, I just see you raised your hand. We'll move to you next. Okay, Matt, go ahead.
Um, I don't really know how to ask this. I've wanted to ask this for a while, but I thought it was too extreme. Uh, Juliet, given your comment on Act 150, what happens when part or some of home care falls apart?
What was that last part, Matt? What
What
happens when what?
happens? Home care. What happens when it falls apart?
From which perspective?
When there is no home care? That's my question.
I mean, I think you know the answer to that. If there is no home care, all of the incredible work that the Commonwealth has done to rebalance LTSS goes in the opposite direction, and you see more institutionalized care that, generally speaking, costs more than serving people in the community.
Yeah, I mean, I know all of that. I guess what I'm asking is, at what point do I start filling out the application for the nursing home? That's what I'm asking you, because that's where it seems like this is all going.
So I don't have an answer to that, as you know. Again, the changes at the federal level that have an impact us in the Commonwealth, as I mentioned earlier. The current impact in 2027 is our focus. A lot could happen in 2028, as you know, the way of politics. So that means there's an incredible amount of work to do. I wouldn't say that, it's a today thing. It certainly is a real risk. Home and community-based services, for the decades that it has been implemented in Pennsylvania, as we all know, is an optional part of Medicaid services. HCBS waivers are optional. They're not a requirement. That's a federal piece, and certainly there's opportunity to educate and advocate for that, though I know many have been doing that for decades.
Yeah, let me just say, I mean, I can echo exactly what Shauna is saying. We've tried to get appointments with the federal legislators. We get nothing. We spoke to Fetterman too, yeah. But I think that all the people on this webinar need to hear that. And I don't think they've been getting like the real deal. Like, I mean, this is going to be very bad. I know that we're getting headlines in newspapers and things could get really bad, but it will get very bad. So I just think you need to make that clear.
I think folks have heard your words loud and clear. Thank you for bringing that up.
It looks like we have time for one more question. We'll go to Pam, and then we'll move on to our
Okay,
speaker,
you good?
and then we'll pick up again on round two. Pam, go ahead.
Hi, this is Pam. Juliet, have there been any discussions yet or any contingency, I don't know, planning or anything around recouping any of the financial cuts from the federal government through any changes or cuts to OLTL's programs, including CHC or LIFE? Are those discussions happening at all? And of course,
So to answer your question related to the state budget,
yeah, well, the state budget or otherwise is there. I mean, has there started to be any discussion that would cause concern about that we could experience cuts in in the OLTL programs? And I heard what you said before about Act 150. I'm just wondering if there is any contingency planning discussions already starting to occur.
So to answer your question, a couple of things. Act 150, there has been no discussions at all about cutting any OLTL programs today in this fiscal year, but we don't have a state budget, so we don't know. I mean, the Act 150 program in particular is on the mandated long-term care payment list. So even during this time where we don't have a budget, the Act 150 program and the workers and those services continue to be paid out. I mean, that's a signal of that program's importance to us. With regards to looking at impacts that are going out, through the years 2028, that's quite a ways away, Pam. So, we hope that things may change, but certainly if they don't, across the board, we would have to look at how do we manage some very, very difficult financial times. But in terms of any specifics or any specific planning, that has not occurred at this point in time. Certainly, there's a lot of concerns that we have and a lot of moving factors. I mean, as you know, sort of pharmaceutical costs have gone up. There's the tariff impacts and things of that nature. So to say that we wouldn't have to look at that in the future, that's part of that potential pathway, but there hasn't been anything concrete at this point in time. Also, for folks to remember, particularly folks concerned about personal assistance services and other life-sustaining services, I just want to remind folks that we're still under the sort of American Rescue Plan Act requirements, and that goes through 2026. So it's a little premature for us to say there's concrete planning or discussions about potential levers at this point.
Okay, good. I think that everyone here just really wants us to stay abreast and involved to the greatest extent we can be in any consideration of that does happen. Thank you.
Absolutely. We will be looking to the LTSS subcommittee to be our partners through the next couple of years as we navigate through this. So certainly for updates and discussions, this would be one of the critical forums for that to occur.
Thanks, Juliet.
Thanks, Pam, and thanks, Juliet. Now, with that, we'll move on to our first presentation. And I want to welcome Nathan Lampenfeld, the Special Assistant to the Secretary of Aging, who will be giving a presentation on a new tool in Pennsylvania, the PA Care Kit. Nathan, the floor is yours.
All right, thank you. All right, can everyone hear me?
Yes, we can hear you.
All right, thank you. So Nathan Lampenfeld, I'm the Special Assistant.
Nathan, I'm sorry. Can I ask everyone to mute themselves? Because I'm hearing a little bit of feedback. Thank you. Go ahead.
Nathan Lampenfeld, a Special Assistant to the Secretary of Aging. Really here to just discuss the PA Care Kit, the new tool that we launched at the Department of Aging. We're very excited about it and sort of how it can improve lives of all kinds of caregivers, whether that's people caring for their parents, their adult children, or anywhere sort of in between their spouses as well. So, we can move on to the next slide. There's just a quote I like to highlight ahead of this from Rosalind Carter. There are 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So really, caregiving affects everyone at some point in their lives. So the PA Care Kit is part of Aging Our Way PA. I'm part of the team that designed and has started to implement that plan. It's really our 10-year multi-sector plan for aging. Really, that's just a strategic plan to help transform long-term services and supports and aging supports over the next 10 years and how we're delivering services. So for context, Aging Our Way PA was built because we recognize there's this demographic shift among older adults. People are living longer, healthier, more diverse lives, and with that, there are more caregivers that need to provide support for those longer, healthier, more diverse lives. We developed a multi-sector plan for aging. It's part of a national movement across the country. It really started in California, but they were the first. We like to consider ourselves the gold standard, as we developed ours quickly and with more comments, more stakeholder engagement, and we've gotten a lot of credit for the work that we did there in hosting listening sessions. So we had one in every county, 210 total, some virtual, some in Spanish, some for specific populations. And we also engaged over 30 different state agencies that have committed to actions in the plan that are our partners in implementation. The plan is designed around 5 high-level priorities, 36 strategic approaches, and then 163 actionable tactics. The tactic that we're focusing on today is that develop a statewide caregiver toolkit. We now call it the PA Care Kit. So, PA Care Kit, it's our new branded name. It's a collection of tools, information, and support. It supports caregivers through key challenges in the caregiver journey. It's personal, practical, and ready for all kinds of caregivers. And we're making options available both digitally and in print. All right. So we developed this tool through 4 main tasks. So number 1, task 1 was the project launch and visioning. That was really just engaging our community members again, caregivers, people with lived experience, to make sure that what we were designing was appropriate, it's what people needed, it's what they were expecting from us. We worked with our team, with our partner agencies to develop a comprehensive vision that's more than just that sentence of a tactic to develop a caregiver toolkit. So what is a caregiver toolkit? What should it look like? What should it do? How should it support people? We also did extensive research looking at other states, other organizations, at their toolkits, and sort of documented what we saw and what we liked, what we didn't see and what we wanted to include in ours, or what we didn't like and wanted to avoid in the development of our toolkit. And then in task 2, we actually got to writing the content, working with our sister agencies, with other subject matter experts, and with other folks to develop the subjects and topics and the actual text that would be included in the toolkit. We also developed a number of different tools or worksheets that really help to facilitate specific caregiving tasks, which I'll get to in a little bit. And then we wanted to make sure that the toolkit was as accessible as possible, both digital accessibility as well as language accessibility, so people who may not speak English or read English as their primary language, but also for readability, so making sure it was appropriate reading level, that people could understand the information that was presented to them. And then task 3, platform development and review. So the Care Kit is housed on the PA.gov website, and then with that, there's some advantages I'll talk about, but we also wanted to build in some additional mechanisms and features of the website. So we wanted to make sure the site was organized, that it was intuitive, that it was easy for people to navigate, and then we also have this Understanding Your Needs quiz, which is our most personalized or customized aspect of the Care Kit, and I'll get into that in more detail as well. And then task 4, launch and outreach. That's really where we are now. And we're on this sort of 2-pronged approach of a grassroots community outreach campaign, and we're developing a formal marketing and media campaign as well. Part of this too, just raising the awareness of what the Care Kit is, how people can access it, and where people can learn more. Next slide. Okay, so I wanted to get into some of the details of the development survey, just some of our due diligence that we did. So I mentioned that Aging Our Way PA was built on 20,000 stakeholder interactions, basically. A lot of that had to do with caregiving and the supports that people were looking for. A lot of comments. That's how we shaped the tactic about the caregiver toolkit. But we wanted to sort of go back around and make sure we got additional feedback from caregivers for this specific project. We received, we had about a month-long survey. We received about 250 responses, and almost 90% of which were identified as family or friend caregivers. Those are, all types of different care situations. So people, older adults caring for their older adult spouses, middle-aged people caring for their older adult parents, or older adults caring for adults with disabilities, or even grandparents caring for grandchildren. There were five key themes that we've identified. So most of these, I think, will be people will be aware of in their experience with caregivers. Just pull my notes here. Okay, so we have low awareness of resources. Can you click to the next slide? I'll just make sure I have that. There we go. Low awareness of resources. So the onset of caregiving is often associated with a steep learning curve. People really don't know what they're getting into. Caregivers are often unaware of programs that may support them and struggle to understand the specific programs, benefits, entitlements, all the different acronyms, the names for programs, things like that. And we know that effective communication and widespread awareness are essential to ensuring that caregivers know about and can access those resources available to them. So trying to meet people in their community. We know that caregivers face a high level of stress. Caregiving is an emotionally complex journey. It reshapes our relationships with the people we're caring for, with our families, our friends, and with ourselves as well. And it requires a lot of compassion, sort of through the more complicated and stressful times of that journey. Caregiving is often too difficult for one person to handle, and building a supportive community network early in the caregiving journey is crucial to prevent caregiver burnout. Unrealistic expectations and progressive challenges. We heard a lot from seasoned caregivers as well that the start of caregiving is overwhelmed, but once people found those resources, those tools, those support programs, the journey became much more manageable. Caregivers felt unprepared for the decline of the person they're caring for and the progressive nature of that commitment. So, when I started, I thought I would be doing this, but I ended up doing a lot more, and I didn't really know what I was getting into. Caregivers face severe financial challenges. There's high care costs, limited financial support, and insufficient assistance, especially for those middle-income families. So people that can't reasonably pay for care out of cost, but aren't necessarily eligible for certain programs that would support them. And we also heard that caregivers need proactive education and guidance to navigate the evolving and unpredictable demands of caregiving, especially when they're new to the role. So giving people sort of a better expectation of what caregiving is. There's not really a clear definition of what a caregiving journey might look like, but we tried to consider that as we were laying out the care kit. Moving forward. So navigation challenges is something we hear constantly. A critical gap in caregiving is the lack of accessible and reliable resources, leaving caregivers overwhelmed and unsupported. Caregivers face challenges with the lack of communication, coordination, and information sharing between their healthcare and their social care systems. So our hospitals and our health systems not necessarily communicating with the organizations in the community that are providing supportive services. Navigation challenges leave caregivers overwhelmed, financially strained, and emotionally isolated, furthering that level of caregiver burden. People feel like they're handling things completely on their own. And many caregivers express a frustration with navigating resources online through automated systems that lack that human interaction. So someone might call a number and get a phone tree that can be really frustrating, or they feel like they have to open hundreds and hundreds of tabs to find and collect all of the information that they need to feel confident in providing care. Next slide. And then some of these themes were just considerations for support. So things that kept bubbling to the top of specific things that people were looking for, specific features or design elements. I won't go into those into detail because we tried to instill them throughout the care kit. And if you could go to the next slide. These are our key design elements. So six sort of elements that we wanted to use throughout to design and anchor the development process. So we have visible and convenient. We want the care kit. We want people to be able to find the care kit, especially when it's 11 p.m. and they're searching for information on their phone, trying to find things, especially before they even identify themselves as caregivers. So it might just be a child or a spouse that's providing care. Realistic and encouraging. So caregiving can be isolating. Many caregivers experience guilt, confusion, stress. We wanted to instill a tone throughout the care kit that focuses on providing a realistic perspective and encouraging and empowering caregivers to feel confident rather than spending too much time, talking about the tropes of caregiving is so overwhelming and burdensome, paints a very negative picture, or sometimes the alternative is, caregiving is full of joy and all these spectacular moments, which may not be true for everyone. So more focusing on how we can encourage people to provide the best care possible, and clear and practical. So again, trying to avoid that complicated jargon or unclear instructions, but making sure that the information on the care kit is directly translatable to people's care practice. Up to date and accurate, so we know that we're constantly receiving new and changing information. Links throughout the different websites can change all the time. We know that the care kit has to be updated regularly and also as things change. So knowing that it's more of a living product than just a booklet or a toolkit that we publish and leave alone. And comprehensive and inclusive, the toolkit should address the diverse needs of different caregivers, acknowledging there's unique challenges that come with different caregiving situations and stages. So the care kit has to be for everyone. It's very vast by design and by nature because it has to offer support and resources for everyone. And then proactive and targeted, so it's essential to support caregivers as early as possible in their journeys, before they call themselves caregivers. And targeted, that's really what we're doing with our marketing and media campaign, trying to make it as publicly aware as possible, not just in our niche communities and niche communication channels. And if you could go to the next slide. All right, so some of the key messages that we've developed, and then I'll actually go to the demo, and I'm going to do the thank you slide because I always forget to do that at the end. But some of our taglines, things that we're using to develop our marketing and media campaigns, as well as sort of just the way that we're speaking about it. So the PA Care Kit, our tagline, personal, practical, and ready when you are. So then some of the key messages we have: no two caregiving journeys are the same. One day you're simply helping out. The next day you're just holding everything together. The PA Care Kit is a collection of tools, information, and support to help you learn more, plan ahead, or catch your breath. It's here to support your role, your time, and your needs, because caregiving rarely comes with instructions. It's a place to find answers you didn't know you needed, a place to find resources that make sense, a place that sees you as more than just a caregiver. Support starts with one simple truth: you don't have to do this alone. Thank you for stepping up to care. So a number of these messages and motifs are embedded throughout. You'll see them. I'll highlight them. And then if you could just move to the next thank you slide. And there's 3 of them. That's right. Okay, so we'll click through all this. But if you could just go back, I want to highlight on the first one. So some of our, a lot of people helped with the development, the iterative review process of the content. But I want to highlight Angie Bixler, who's the PDA digital director, who's developed the whole website and helped with the navigation and also all the very nice looking worksheets and resource guides. And then Meredith Hughes, who's with the University of Pittsburgh and was also placed in PDA as a National Academies of Medicine Fellow, and helped with the development of that content. And then a couple things just as I move to the demo. I'm going to switch seats and actually go on the website. But if you can look, so this is, again, a living, breathing product. We want to make sure that it's addressing the needs of older adults, of people with disabilities, and caregivers, so all kinds. So looking for suggestions as we continue to evaluate and update this. And, for example, we just added a new drop-down for substance use disorder. So we're adding new things every day to make sure that this is as comprehensive as possible. And I'll switch over. Can everyone hear me up here now?
Yes, we can hear you.
We'll try it. Okay, so like I mentioned, the PA Care Kit is housed on the PA.gov website. There's a few advantages to that. It helps with our search engine optimization rather than being a separate website as part of the PA.gov. They call it the web or digital presence. It just helps us get more clicks, more traffic, and things like that. It also helps with our connectivity to other programs like Community Health Choices or Act 150, where people might be on the DHS website and can be more readily connected to the Care Kit. It also helps with our language accessibility. So if my operating system is set to Spanish, this website will automatically translate. But say I'm someone who primarily speaks Spanish, but I don't have access through broadband on my personal device, So I go to a library and the computer is in English. I can click translate and go down to Spanish and click it, and all of the text is automatically translated to Spanish. Back to English here. All right. So there's our title, PA Care Kit, our tagline, personal, practical, ready when you are. And then again, some of our language that we're trying to, supportive, empowering, key messages. And then we have two sort of call to action buttons. First is the Take Your Understanding Your Needs quiz. I'll talk about that a couple times before I actually get into it, and the Apply for the Caregiver Support Program. So what we've developed with the Care Kit is that it's its own standalone product. It's all of this information, these tools and resources and things like that. But we also designed it to be a conduit to our existing programs in the community, like the Caregiver Support Program, like the Area Agencies on Aging, the Centers for Independent Living, or Community Health Choices. And then moving down, so another one of our key motifs is thank you for stepping up to care, sort of our way to succinctly acknowledge caregivers for the hard work that they're doing. And we have a couple step sort of metaphors throughout. And then, so all of the information on the Care Kit is housed in these three sections. That's first steps. So where do I get started? Maybe I'm a brand new caregiver. I don't even call myself a caregiver. Or maybe I'm someone who's dealing with a new level of care that I have to provide. This is really where I would go. And then there's caregiving resources and self-care resources. So how do I take better care of the person I'm caring for? And how do I take better care of myself? These are more off the shelf. If I know where to look for, or I know what information to look for, I know how to articulate my needs. This is where I would go. A couple things we have on the homepage as well are key caregiving terms and concepts. Right now it's basically a glossary. We're also working on a video as sort of a top 10 things you need to know. But this glossary has all of the definitions of the terms that you would need to know. So if I click M, I'm looking for Medicaid. This is a clear, understandable definition of Medicaid, and we'll have to add a link there to the federal Medicaid website. So you're always finding new things to add. And back to the homepage, we also have this section on become a professional caregiver. So throughout we heard, that there is this direct care worker shortage and crisis. But we also have all of these people with lived experience learned experience of being a caregiver. So we wanted to add some information on how to turn caregiving skills into a career, what that can look like in Pennsylvania, and where to learn more about how to do that. All right. So I'll start with the first steps page. You also have this navigation pane on the left side here, where it's really the Department of Aging. I can go to different pages there, or I can click the sub pages, but I like to click the big one. All right. So first steps, again, there's that Take Your Understanding Your Needs quiz button. But then moving down, we move to first 5 steps. This is a framework that we developed that's intended to help caregivers systematically and methodically assess their entire caregiving situation. So you have step 1, understanding your role. Before you begin, take time to reflect on your role as a caregiver. Step 2, gather information. Being informed will empower you to make decisions with confidence. Step 3, strengthen the support system. Caregiving is not a solo journey. Build a team to help. Step 4, make a plan. Planning reduces stress and ensures no detail is overlooked, especially in an emergency. And step 5, take care of yourself. Caregiving is hard work, and your health and well-being matters. Again, we're trying to get caregivers to, rather than think of the frantic day-to-day tasks that they have to provide, thinking of it more of a step back, methodical approach, and really think critically about all aspects of what they need. Start thinking about how to articulate their needs, and also we want to center the caregiver. It's not just about the care recipient, it's about where they fit in the care situation as well. So that framework is embedded through a number of our resource guides throughout, and I'll start with the general resource guide, which you can access here. And it's called the Get Started Guide to Caregiving. Again, we have a nice, lovely design. And the intro here is called Stepping Up to Care. I like to describe it as the what to expect when you're expecting of caregiving, knowing that, before someone becomes a parent, they have months or, 9 months or so to prepare for their journey. A caregiver might have months, weeks, days, even hours. Sometimes it's a phone call. So we're trying to sort of describe what a caregiver is, what the key milestones are that you may face as a caregiver, and again, infuse it with that supportive, encouraging language. This is something people can take on. It's manageable with the right supports. And then we go through each steps. There's a page for notes, so people, again, can jot down what they're thinking, start to articulate their feelings and thoughts and needs. So step one, understanding your role, goes through questions about where you fit in the care situation. So understanding what kind of support the person you're caring for needs, what support you're providing, how your responsibilities might evolve over time, how you're feeling about the role, what motivated you to take on the responsibility, how caregiving has changed your relationships, what areas of caregiving feel most challenging or overwhelming, what feels most rewarding, and how does caregiving affect your personal goals? Again, trying to think of not just the care that you're providing and this immediate, frantic, day-to-day task, but thinking about it more longevely. And then step two, gather information. So this is more about the specific care practice. So what does the person you're caring for value most at this stage in their life? How can you best support their emotional and physical well-being? Are you communicating openly with the person you're caring for? What information do you need to improve care? What type of health conditions is the person you're caring for living with? What medications does the person you're caring for take? What benefits or financial aid are available? What tools and technology can assist you? And then we move to that support system. So families, friends, neighbors, professional organizations, who can offer help? What kind of help can they offer? And when can they offer help? And that's really about caregiving tasks. And then we ask who can offer emotional support. So who's supporting you when you need it? That shoulder you can lean on. What information do you need from your health providers? Are you communicating openly with your support system? What community or professional resources are available to you? And what organizations can offer support? So here we highlight the PA Link. This is a 1-800 toll-free number that you can call, speak to a real person to get some resources. It's also another project of the Department of Aging that we're working on refreshing, strategic planning to really improve that program. And then step four, and that's of course for both older adults and people with disabilities under 60 as well, and caregivers. And step four, make a plan. So trying to get the caregivers to think more prospectively about the care situation. What does a typical day look like for you and the person you're caring for? How can you make daily activities more efficient? What are their long-term care needs? When are the next medical appointments? How do you prevent accidents in their living space? How will the person you're caring for be supported in an emergency or if you are unavailable? And what are their wishes for care in the future? So those long-term medical and end-of-life decisions. And then recentering the caregiver with step five. How do you take care of yourself, your self-care, your personal needs? Are you managing stress, taking care of yourself, eating healthy, exercising, sleeping well, taking time for those hobbies or other things you might enjoy? What support do you need to feel balanced? And that balance is sort of a word that kept coming up in the data where people weren't necessarily saying why they felt terrible or they were feeling overwhelmed, but they said they were out of balance or they needed to get back into balance. So trying to use words that resonate with caregivers. And do you know where to seek additional help? So encouraging people to look at support groups, counseling, respite, caregiver support program. And then this last question I'd like to highlight as well. Are you celebrating successes? So often as caregivers, we focus on what we do wrong, especially when we learn new information. We think about how we should have been doing something all this time. But we want people to recognize and reward themselves for the hard work that they do, balancing their personal lives with caregiving duties or career responsibilities, but also recognizing the ways that they're improving the quality of life of the person they're caring for. And then we have 5 resources for caregivers, our AAA's adult day centers, senior community centers, the PA Link the PA Link, and community support program. Then we highlight some of the helpful printable worksheets, and I'll talk about those in a little bit. All right. So then we have the many faces of caregiving. So these are 9 archetypes, basically 9 common caregiving scenarios that we thought would help people provide stories that would help people resonate with their situation, knowing that I could be a sandwich caregiver and a dementia caregiver and a long-distance caregiver, but, ways to personalize this a little bit more. So we have a spousal caregiver, someone that's providing care for a partner or spouse, long-distance caregiver, someone providing care from afar, parent caregiver, that's an older adult providing care for a person with a disability, working caregiver, someone balancing their career with their caregiving duties, the solo caregiver, that is someone who without the traditional family support system, sandwich caregiver, someone caring for a child and a parent, dementia caregiver, highlighting this specific condition because it comes with additional nuances and expectations. The youth caregiver, someone in their 20s, teens, or younger, that's supporting either their parent who's the primary caregiver or they're just the primary caregiver, which is becoming more common with these expected Medicaid cuts. And grand family caregiver, someone providing care for a grandchild, oftentimes the biological parent is not involved in the care situation. So, for example, and I'm going to have to move through this a little quickly because I want to get to the understanding your needs quiz. But you can click down to what resonates with you most. There's that definition. Each of these have a vignette to sort of illustrate the common experiences with the care recipient, with the caregiver, and then halfway through, it offers sort of where the care kit can provide solutions and resources to help you along the way. There are downloadable booklets very similar to the one, again, that introduces that vignette. And then the questions are just tailored a little bit, again, trying to speak to that caregiver for the specific situation. And I'm going to move down to the Understanding Your Needs quiz. So this is our most customized section of the care kit. If you can imagine a BuzzFeed quiz, if you're familiar with those. But it asks specific questions. It goes through the same 5 steps about my caregiving situation. So how often do I provide care? Who am I caring for? How long have I been providing care? What types of health and wellness care am I providing? What types of health conditions am I helping manage? Do I regularly receive support? Am I comfortable asking for help? How has caregiving affected my relationships, including with myself? About making a plan, so long-term care needs, housing needs, and I'm just clicking these all over the place. Transportation, mobility, social participation, financial and legal planning, crisis situations, those 3 key crisis situations we like to have people focus on. And do I know where to go for additional help? How often do I feel overwhelmed? How is my physical well-being? How is my emotional and mental well-being? And then I get to the review page. I can change any answers. And I would put my name and email address. So I don't have my laptop, but I put my name, my email address, and I would get an email from pacarekit.gov, a resource account that's reliable with a subject line, PA Care Kit, Your Get Started Guide. And then there's a custom resource guide. It introduces, a short intro about caregiver burden. Then it goes through all the 5 steps, and each bullet on that guide corresponds to how I answered questions. It'll provide, specific language tailored to me, and also links to various places on the care kit where I can learn more or access worksheets and things like that. And maybe if we have time, but I did want to go over some of the subjects and topics that we have included in this caregiving and self-care resources. So financial planning and paying for care, chronic condition management, aging and community, technology and products, so there's different devices, modifications, adaptations, safe driving, communication tips, caregiving in a crisis, caring for veterans, end-of-life care, legal support, long-term services and support, so highlighting those different settings and levels of care, medication management, and then our printables, which are 15 worksheets that help with a specific care task, like budgeting or a needs assessment or coordinating with professional families, friends, caregivers, making sure who's doing what on what day, making tough decisions, so involving everyone in the care situation and going through those different solutions and making the final decision, emergency preparedness, end-of-life planning, funeral planning, home health hiring, so making sure I know what questions to ask someone before I'm having them come into my home and take care of my loved one, home safety, so going through the house, evaluating hazards, making repairs or other changes, older adult housing, so going through, again, making sure we evaluate those options, keeping track of sensitive information, in-person visit worksheet, long-term care facilities, so again, this is similar to the home health, except I'm going into a facility, making sure I'm asking the right questions, feeling confident that I can make the right decision, managing medications, and the medical appointment worksheet. And then we have all 10 of those resource guides, again, available. Self-care resources, this will be quick. Physical and mental self-care, emotional self-care, respite care, caregiver support groups, and working caregivers. And just to highlight an example of what these pages look like, I encourage everyone to look on their own, but there will be a short summary intro. Then we'll have, instructions that are long enough where you feel like you're learning something, but not so long no one's going to read it. But everything in clear, understandable language, bulleted. And for this example, for this one, we highlight the different types of emotions. And then, so I'm feeling angry and frustrated constantly. This is how that might manifest, how I might feel, and then resources to learn more about coping and being more proactive. We often highlight some additional resources on the side panel here as well. And like I mentioned, we're providing these resources digitally and in print. We're really working with libraries on this, so we're shipping printed materials, like a big box of printed materials, to every library, to every AAA, to every senior center, to every adult day center, and to the General Assembly. Hopefully they pick up their boxes and bring them to their local communities. So people will be able to go to a library and get printed materials, or they can ask a librarian for some support in navigating this website and doing the quiz. So I wanted to leave some time for questions. So I don't know if I can see questions online or in person.
This is Kathy. Thank you, Nathan, for your presentation and your work with Aging Our Way PA and the PA Care Kit. We can take maybe a couple of questions, and I don't know if you could stay until our second public comment period. If not, other questions could be addressed in our
Yes, I will
follow-up.
stay. So.
Oh, great. Thank you. Go ahead.
This is Monica from the Brain Injury Association of Pennsylvania. I just have a question. Thank you. This looks very comprehensive. I look forward to getting more in-depth view of it. But how about people who aren't tech savvy? Is there an alternative for them? Is there a print version or for people who are not able to navigate a website like this?
Yeah, we wanted to make this as accessible as possible. So like I said, there will be boxes of printed materials. I think there's 100 of those general guides and 25 of those, each of those 9 tailored guides. We're printing a number of the worksheets that we think will be most common, some business cards, some nice folders so everyone can put everything in there. So all those printed materials are going in boxes, and we're shipping 3 boxes to every area agency on aging, 1 box to every senior community center, to every adult day center, to every library. There's 600 of them, I think, across the state. And I think there was 250 boxes each to the House and Senate for them to pick up and take as many as they'd like. And we would be happy to print more next year as we make, more adjustments given the funding and all of that.
That would be great. We'd love to have some. And one more question. Did you say that?
Hold on.
Okay, sorry.
Bridget, sorry. I just want to close that out. I know most folks are already aware of this, but certainly if folks need that information in an alternative format, large print, audio, braille, etc., I imagine all they need to do is contact the Department of Aging, and they can make arrangements for those alternative formats for this material.
Yes, correct. And the website as well, if, we can make accessible printed materials, but also the website, I should have mentioned, is fully 504 compliant. I can't remember the number, but so available or good for screen readers and all of that, and same with the PDFs and printables. We made sure they're fully digitally accessible.
Great. And did you say there was a number people could call if they want to speak with someone?
So the PA link is a 1-800 number where people can, speak to a live person. We're sort of encouraging more people to go to the PA link as part of our refresh project that we're working on. Or you can email carekit@pa.gov or the website. And I do not know that. I should know the number, and I don't. So
that's okay. Thank you so much.
All right. And we might have time for one more question, or I can wait for the public comment as well.
No, we can take one more. This is Kathy. We can take one more question. Is there any questions in the room?
Lloyd. Thank you. You did a great job of that presentation. Thank you very, very much. Appreciate it. Have you ever provided care?
Yes, I was a caregiver. Well, I would say youth caregiver, because it's nice to use those terms, for my grandfather and my grandmother, and I also supported my mother, who was a primary caregiver.
That shows. So thank you very much. My second part of that question is there funding attached to this? Will there be funding pushed out?
So we received, as part of Aging Our Way, we received $2.95 million. This was the largest project, and I think it's 1.2 we carved out for this specifically. We didn't use any funding developing the content or anything like that. Everything was to build the site and to build this marketing and media campaign. So we were trying to be as efficient as possible with the resources, knowing that the biggest thing we heard was that people need to be aware of the Care Kit. And in turn, being aware of the care kit and getting connected to the resources will help people get connected to the Aging and Disability Resource Network and all of our great programs.
Thank you.
Yes. Okay. We'll wait for public comment.
Was there any other quick
Uh,
question from the room?
Kathy, this is
uh,
Minta. I
Go
don't
ahead,
have any
Minka.
I don't have any questions for her, but whoever is on the captive camera on their computer, if they would take it off, I would appreciate it because I can't see half the uh, information that you're posting.
Thank you, Minta. Carol, if you're able to have your attendant shut off your camera, it would be helpful for people to see the slide. Oh, thank you. All right, thank you so much. I think with that now, and I'm glad, Nathan, you can stay
you
for
want to say
additional
something?
questions.
Yeah.
And again, everyone, please mute.
I want, I
Oh, I'm sorry,
wanna,
Carol.
uh, I don't know how to put this in the proper term, but, I appreciate your effort, but I miss being somebody when we need care for about 40 years. I just am worried, and I really worry that till that all the evidence is placed on the caregiver, and yes, I know there is you. I know that, but I am a person. I am not a body or a mind. I don't wake up in the morning to receive person. Okay, I have a day. I have a life, and I want to live that life the best way I could. Now I try that everybody different. I know that, but I find when there's different rules and regulations, and documentation, the client gets lost in the dialogue. And I know, yeah, like I don't appreciate when caregiver are talking about my care. Within my care, I have ownership of my care. Without me, I really don't appreciate a lot of documentation outside of what I say. I know, I understand your side, but there's another side. Maybe it would be good to be care caregiver toolbox for consumers, because what happened is a lot of times people who grew up being advocates resent being directed what to do. We really do. And I think there has to be some kind of compromise.
So,
Yeah, I can. The care kit, the way that it's organized in Aging Our Way PA is that it's under the strategy to support unpaid informal caregivers. So that's really what this intervention is targeted. We try to be as inclusive as possible, so it's not just older adults, but older adults and people with disabilities under 60. However, as part of Aging Our Way, we're also working on audit and improvement of the 2019 Direct Caregiver Blueprint, which it sounds like is a little bit what your question is more focused on. I would encourage you to join their public meetings. So the Long-Term Care Council was the steering committee for Aging Our Way PA, as well as they are taking on this the redesign of the blueprint. And that's, I think, the best avenue to address your concerns. And I can share that information with you after as well.
Thank you so much for that feedback and response, Nathan. And feedback, Carol, and response, Nathan. And with that, we're going to move on to our next presentation, the provider revalidation process. I want to welcome Megan Brandt and Matthew Ebel from the Division of Provider Operations at the Bureau of Fee for Services Programs at OLTL. The floor is yours.
we're just taking a moment to transition.
Hi, my name is Megan Brandt. I am the section chief within the Division of Provider Operations within the Office of Long-Term Living. Today, next to me, Matt Ebal is our enrollment and certification supervisor. He is going to be giving a presentation on our provider revalidation process.
Good morning, everyone. As she had said, my name is Matt Ebal. I am the supervisor for the enrollment section within Provider Operations. I supervise 10 employees under me. Not all of them work on applications, but all of the revalidation, new and reactivation applications for Act 150, Community Health Choices, and OPRA waiver are through our section. I appreciate you having us here today to give some reminders on the revalidation process. I know that 2025 is a heavy revalidation year for us in the enrollment section. Obviously, it's hard to believe it's been 5 years since COVID started, but since revalidations are required at least every 5 years, we have a lot of providers that are due for revalidation this year. And so thus we've received a lot of questions about revalidating more so recently than we have in previous years. So I appreciate you giving us the opportunity to come here and discuss a little bit about that process. So federal regulations require that all state agencies revalidate every 5 years. Every providers revalidate every 5 years, regardless of the provider type. The Office of Long-Term Living, we do recommend that you submit your revalidation at least 3 months ahead of time. That gives you a little bit of leeway before your revalidation date. And all applications, whether it's a new application, a revalidation, a reactivation, are going to be submitted via the application portal. Now, that's for Type 59 providers. If you're a Type 3 provider with nursing facilities, or if you're a life provider, there are some exceptions where paper applications are required. But for all Type 59 providers, the home and community-based services providers, their applications are submitted through the portal. So the first step really is to locate your revalidation date. We see a lot of emails come through with providers just wondering when they're due to revalidate. It kind of seems simple just to look at when your agency was approved and think that, well, my revalidation date must be 5 years from that date. But it isn't necessarily so simple. The validation date that the revalidation date is based on, that is entered actually during an earlier part of the application from when it was approved. That is when exclusion checks are run on the provider's ownership and managing employees that are submitted along with the application. So the revalidation date generally will be a little less than 5 years from when your approval was actually given. So it is important to make sure that you're actually checking what your revalidation date is, because it's not as simple as doing a 5 years from the date that my agency was effective or the last time I revalidated or reactivated. Using that date and just adding 5 years is not going to give you an accurate picture. You do have access to finding what your revalidation date is just via the Promise Internet. When you go into the system, you do need to log in, and you'll be directed to the page on the screen. I am glad it's a little bit bigger on the screen than it is on my laptop. It is some small print, and it can be a little fuzzy with the font that Promise uses. So where that red arrow is pointing, once you're logged in, you would be selecting Enrollment Summary, and that'll be found on the left side of the screen where you see that red arrow pointing. Once you select the Enrollment Summary, you'll see the below page. And right where that red arrow is pointed in the top right of the screen, along that blue bar there, is where you will find that revalidation date for that service location. One thing I also generally want to clarify is that every service location you have is going to have a different revalidation date. I have had instances where we have received questions and just overall confusion from providers that believe that, if one service location is up for revalidation, that they need to submit a revalidation date for every service location they have. So it is important to go in and just validate that the date that you're looking at is for the service location that you are attempting to revalidate. Because unless those service locations enrolled together at the same time, you're going to see a different revalidation date in that slot. So for providers and agencies that do have a lot of service locations, I understand it can be annoying to log in and go into each individual service location to locate that revalidation date. There is an option through the enrollment summary page where you can download a list of your active service locations, and you'll be able to export that into an Excel spreadsheet that will provide a lot of useful information about each of your service locations, which would include the revalidation as well. It'll include the provider number, the NPI if applicable, the revalidation date, your provider type, name, address, the specialties that they're enrolled in, and the taxonomy codes. So it can be a useful way to be able to see all of your service locations in one area and be able to track what their individual revalidation dates are. So how to actually revalidate? The first step is to log on to the Promise portal using your login credentials that you used or created when you originally enrolled the service location. I do hear from a lot of providers that get stuck on this part where they forget to log in and they don't have the option to revalidate and can't figure out why. So it is important that you're logging in using those credentials that were created and used when you submitted the original application. This is one of the most important fields on the application and one of the ones that you're going to come across first. Most things that you do on an application can be corrected after the fact, but there are a few things that can't be changed, and if they're entered incorrectly, the application will have to be redone. There's not an ability to make adjustments to it after the fact. And this is one of the screens right here that you'll come across that needs to be selected correctly, or you will end up having to redo your application. And that certainly is not additional work that any of us want to do. So I would take note of the screen. It's one of the first you will come across when you go to revalidate. And when you go to start that application, those fields, how they look right there for a Type 59 provider is how they should be entered on your application. You need to make sure that you're selecting Pennsylvania Medical Assistance under program type, and then Type 59 for our OLTL programs, the HCBS programs. And enrollment type will always be facility for OLTL currently. Now, another area of confusion that I do get is that regardless of whether you're doing a new application, a revalidation application, or a reactivation, the required documents do not change. You're required to submit the same documents that you submitted when you submitted a new application. Your policies will be reviewed again. Your financial documents will be reviewed again. And it doesn't matter what type of application. If you're revalidating, then you will submit those same documents that you submitted when you submitted a new application. So there is no difference in the documents that are required for revalidation when compared to submitting a new application for a new location or a reactivation for a location that had previously closed that you wish to reopen. So just starting from the base application itself, as part of that base application, there are some documents that are built into the application portal itself. So the ownership disclosure, the outpatient provider agreement, the HCBS waiver agreement form are a part of the application itself. They are listed on as required documents within the application, and you can actually submit the application without signing those forms, but you will have the opportunity to complete those forms while you are filling out the application through the portal. We are required in the enrollment unit to verify the fiscal solvency of a provider. We have had questions about why we ask for these financial documents, and they're used together. Not any individual document is used to create a determination. It's a combination of these documents that are used to determine whether a provider has enough funds available to provide services in case there was an interruption to billing or any other short-term or medium-term issue that may have caused an issue with funding. This is just for participant safety and making sure that you're able to provide the services that you're enrolled in to your participants if there is a minor hiccup in billing or some other issue that causes a funding problem. Insurances are required. One area of confusion we often come across is providers submit the accord form for their declarations insurance. For their commercial general liability insurance. And that is one verification that we're not able to accept for general liability. We are able to use that for workers' compensation if you do have employees and are required to have that. But for commercial general liability, we are required to have the declarations page. So please ensure that that is being submitted and not the accord. That is probably one of the more common documents that are sent back to providers. And I do realize it can sometimes be a little bit of a hunt if you did not have that document ready already. So definitely one to keep in mind when getting your documents together for revalidation. The business registration documents are required to be submitted again. That would be your legal entity verification document that comes from the IRS. It's a document that's requested, and it will have it'll be on IRS letterhead. You'll see the IRS name and their address on the top left. Your FEIN number will be on it. And we're validating your legal entity address that is registered with the IRS and the FEIN that has been entered on your application. If you are a corporation, we would require your articles of incorporation and your fictitious name registration. Or if you're a partnership or have any other type of business creation agreements, those would be submitted as well. Now, for the actual services that you are going to be providing, we have our the OLTL provider enrollment information form. That does change. I'm not going to say frequently, but usually about once every year or every 2 years, there's some minor adjustments to it, depending on if any services are added. For instance, we had chore services recently added, and we had a couple of telehealth services added as well. which led to an update to our enrollment form. And the most recent form, I believe, you'll see will have a date in the bottom of December of 2024. So do make sure you do have a current form. If you have an older one and you do need one from OLTL, please reach out to our resource accounts, and I will have that information at the end of the presentation for anyone who needs OLTL's contact information. So on the provider enrollment information form, or just the PEIF is usually what we refer to it as, that's where you're going to select your services. That's where you're going to select the counties that you wish to provide those services in. And there are some basic questions generally related to the final rule, asking about the settings that these services are going to be provided in. You can select additional services if you wish that you are not just revalidating, that you don't already have on your provider profile. They can be added. Through the revalidation process as well. It would just function as basically a change request just done through the application process. But do make sure that you are selecting the services that are currently on your provider file as well to ensure that we are able to revalidate those. For the most part, our enrollment specialists do catch if a provider selects a service on the provider enrollment information form that they did not select on their actual application, but occasionally it is missed if there is a discrepancy. So do validate when you do receive those approval emails that all the services that you wish to revalidate or all the additional services that you wish to enroll in are also included on that approval email. And so along with that PEIF, you would also, depending on what services you select, you would submit your license or service or certification. That could be your Department of Health home health agency license. It could be a home care license from DOH. It could be a CARF accreditation. It could be a PUC license for non-medical transportation. Just whatever services you select that require a license or certification, and it is outlined on the form itself what is required when you're selecting a form would be submitted along with the application. And on top of that as well, for any services you do select, you would submit a job description for the care workers that would be providing that service. So if you select multiple services, you would submit a job description for each of those care workers for each of those services on the enrollment form. Similar to what was submitted when you submitted your new application, you are required to resubmit your policies. Listed there, you have your ADA compliance policy, your criminal history background check policy, critical incident management, employee health care exclusion checks, your social security number verification policy, HIPAA compliance, LEP, non-discrimination, participant complaint management, along with the complaint form, your quality management policy, regulation compliance, and staff training. Those are the same policies that you would have been required to submit when you originally renewed or revalidated 5 years prior to submitting this application. And one thing I do caution is that OLTL's requirements, our guidelines, our policies, they do change. We do get updated clarifications from policy as well. So something that a enrollment specialist might have approved 5 years ago may not be okay now, or they might need additional edits. We do get additional guidance, but please understand if they do return it to you that some guidelines or some aspects of policies and the language that are required in the policies themselves, it does change every once in a while. So they may ask for some minor edits to your policies, even if they were approved 5 years prior. And then there are, it didn't really fall under a category, but you are required to submit the qualifications of the executive director or program director. That also includes their diploma, their highest diploma or degree obtained. If they do not have a diploma or degree or a signed letter with a seal on it, or there's additional acceptable forms of verification if you had obtained your diploma out of the country, for instance. But if you're unable to provide any kind of diploma or any kind of acceptable form of basically to verify that you verify your highest degree or diploma received, there is a basic skills competency test offered to the DOH that would be required in those instances. So please keep that in mind when they do send those requests back for this highest degree or diploma that executive director or program director has received. So once the application is actually submitted, it goes through a series of automated checks first. That generally can take up to 10 days. And the initial review for completeness is actually done through the Office of Medical Assistance Programs. At that time, any corrections that need to be made, and often that is a social security number, date of birth mismatch, some issue with the automatic validations, some issue with the license being submitted, something expired, that information will be submitted or returned back to you through the portal itself. You will receive a return to provider message, and that information will be sent to the email that was submitted with the application. So it is very important to make sure that contact information that is on the application is accurate. After that is returned to you from OMAP, you have 30 days from that return date to return those items that they are requesting. Now, if they do not receive a response within 30 days, the system will automatically close the application. And if that happens, there is no way to reverse that through the application portal. So it is very important to make sure during that original review period that you're being responsive and keeping an eye on your mailbox for anything from the application portal, because those will be automatically denied if the response isn't received through the portal. And any items that are requested through the portal, those will also be resubmitted through the portal. Now, once that application once that revalidation application passes that initial check for completeness, at that point it is routed to OLTL, and that's where we get to more of the nitty-gritty of the review of your policies, the review of your financial documentations, the review of your insurances, the more in-depth review. We do have a queue, as we do have a limited amount of enrollment specialists, so the application will go into a queue, and from that queue it gets assigned to an enrollment specialist to be worked based on when it was received. After the enrollment specialist conducts their review, they will send an email to the contact on the revalidation application detailing items or corrections that are needed for OLTL approval. Now, this will not come through the application portal. This will come directly from an OLTL enrollment specialist. This will come through email, and there'll be a Word document attached that has a checklist on it. And that checklist will detail all the items that are needed or corrections that are to be made. Feel free to write back to them if you have any concerns about the information they were requesting. If you disagree with their determination, it can be escalated to supervisor review if you disagree with any of the determinations that are made by them. So once the OLTL returns the application back to you by sending you that email with a checklist, you'll have 30 calendar days to provide the items requested before a second request is sent. And then after another 30 days, you will receive a final request. And then after an additional 30 days, the application will actually be rejected if you remain unresponsive. So in addition to that 30 days that you get to the application portal, it's a little bit different with OLTL. We give you a lot more opportunities to respond if it's getting lost in your email box, or you have it, you just are not receiving the information. So you do have multiple opportunities to resubmit that information before the application is actually rejected. So in total, you generally have about 90 days to respond before you reach that point where the application will be rejected. But again, I will note it is important to maintain accurate contact information. One of the biggest reasons that we see that we don't receive responses is that an email address was incorrect, maybe even changed during the application process, or something like that, and the emails were not received. Okay, some additional notes. One thing I always want to clarify is that you have your revalidation date. And the way that the Promise system works with revalidations is they work on an auto close process where your provider file will be automatically closed the last day of the month that the revalidation was due if it does not detect an application that's been submitted through the application portal. So, for example, if your revalidation date is today, we'll say August 6th, you have technically until August 31st to get that application submitted in the portal. If the application portal does not detect a revalidation application for that location on August 31st, they will auto close that location for failure to revalidate. If that does happen, then at that point, there will no longer be a revalidation application. It would be a reactivation application to reopen that location. And I also want to clarify as well. So when you submit that application, that revalidation application, there is a hold placed on your promise file. And by that, I mean, if it's a text application, your location will stay active during that entire application process. So it might take a couple months to review and approve your revalidation application. But as long as that application stays active in the system and you're being responsive, then your location will remain open during that entire time period. You will not experience any interruption in billing or anything like that. It is important to remember, though, if the application is eventually rejected for failure to respond in the future, for not being qualified for whatever reason, the closure date of that location will be backdated to what that original closure date would be if you had not submitted that revalidation application. So going back to my previous example, your revalidation date is August 6th. You get your application in before August 31st. So your service location remains open as you go through the application process. And let's say you have a couple of back and forths with the enrollment specialist reviewing the application, and then you remain unresponsive for 90 days, not responding to any requests for information or any of the follow-ups. If that location is eventually closed, and let's say that that's in October or November when that does happen, and that application is rejected, the system will then backdate that closure for failure to revalidate back to August 31st. It will not close you when that application was actually rejected. It is backdated. So it is important to remember to to ensure you remain responsive during that period of going through the revalidation application.
So the last part, second to last, on the additional notes is the revalidation reminders that are sent. Providers receive a revalidation reminder both 90 days and again 30 days before their revalidation date. Those reminders are first sent to the mailing email address that we have on file for the service location. So as Matt already stated, very important to always keep your contact information up to date. There is a batch system process that is run, and it's actually run prior to those 90 days, because if the system identifies they do not have a valid email address for that mail to address, then what it does is it drops it to a paper notice, and that will then generate a letter that will be sent out to the provider. That is done both 90 days and 30 days, you receive those 90 and 30 days in advance, and that process is run each night through our vendor. It's not a once a month process. It is run every single night to capture anybody that has a provider revalidation date. So just to really stress the importance, always keep your contact information up to date for all your mail to, your pay to, your service location, your IRS. All of those should always be up to date. But the reminders are just reminders. It does remain the responsibility of the provider to submit their revalidation in a timely manner. Providers, as Matt showed previously, do have access at any time to go into their portal to determine when their revalidation date is.
Thank you, Megan. And I'll just continue that we often get requests to expedite revalidation applications or to ask how long before my revalidation application is going to be finished. And I know we do hear there's some frustration because our staff, they're going to provide very generic information. Revalidation applications are worked in the order in which they receive. Generally, we do not expedite revalidation applications. The provider will stay active. Instances where we will expedite applications generally revolve around reactivations and change of ownerships or any issues that have that come across and can affect participant safety. So in general, revalidation applications are going to be worked in order in which they received. If you contact the resource account, if you can contact the enrollment line, they can provide you very generic information. But as far as a time frame, they're not going to provide a time frame, because if we were going to do that, we'd probably have to be so conservative that it wouldn't be very useful for the provider anyway. There's a lot of variables that can affect how long an application can take to process. So they can kind of give you just a loose idea of where you are in the process, but they're not going to be able to provide you any specific information such as, your application is going to be approved in a month or 2 months or whatnot. Like I said, we'd have to be so conservative to make sure that, we're not overshooting dates that we're promising to providers. So in general, we just do not provide timeframes for the processing of applications. Okay, and then I just included a couple of resources on here. Any questions about revalidations, applications, enrollment with any of OLTL's programs can be directed to our resource account. When you receive requests for information, when your application is returned by OLTL with that checklist, it's going to come from that resource account. Any documents, anything that needs to be submitted that's requested in that checklist can be responded to that email address. We just recommend that you respond directly to the email that you received. If you do need to talk to a member of enrollment staff, the helpline is available Monday through Friday, and you can reach them at that 1-800-932-0939. That's option 1. If you were to go to option 2, you would reach our billing department. Yeah, I will point out that the top email address looks like I missed the RA dash in front of it, so I'll make sure to correct that. It's a resource account, so it's RA-HCBSENPROV@PA.gov. Okay, and then just below, there's some technical support lines. The Gainwell helpline is for the application portal or any technical issues that you're having in Promise. I do have to caution, it is for technical issues only. If you're receiving a technical error, a lot of times things that we think or that are thought to be technical errors turn out to be an issue with your enrollment information. It could be an address or something like that, or something to do with the service itself. So they may direct you to the OLTL enrollment line, but if you are having specific technical issues with your login or something that needs to be dealt with by IT through Promise, that is the number that you would use. And I also included the HCSS helpline as well, if you're having any technical issues with HCSS. And that goes the same with HCSS as well. It has to be something technical that they'll help with. If it's something that needs to be adjusted, in regards to the services or counties that are registered on HCSS, they're going to direct you to the enrollment hotline and OLTL to help to make those corrections. For your reference, I included the regulations below that govern OLTL enrollment, as well as a link for the waivers. And you can find the OBRA, CHC, and Act 150 within those links. And within the waivers themselves, you'll find the service definitions that can help guide you in what you need, what the requirements are, whether that's licensure or staff required to provide a specific service. So you can find those within the specific waivers themselves, as well as the regulations, the Title 55, Chapter 52, and Chapter 1101 general provisions as well. Megan, unless you have anything to add, we can take any questions you may have.
I just had one thing to add. Matt and I worked to create an OLTL revalidation quick reference guide. So it contains all the information that is in this PowerPoint. In addition to that, it also contains an FAQ document for our revalidations for provider type 59 and for provider type 03 for the facilities, as well as a resource document. So we were waiting to give this presentation, but we will be issuing this, I believe, via a listserv so that everybody will have access to that document as well.
This is Kathy. I want to thank Megan and Matt for your presentation. I think we could take one question before we move on to our second public comment period. Any questions from members?
There are no questions from the committee members.
Thank you. Anyone remotely? Any member remotely? Okay. With that, we'll I want to again thank you, and we'll move on to our second public comment period. I know someone's had their hand up since we near the end of our first public comment. I don't know if that person could be unmuted to allow to ask their question or make their comment.
I don't know, while we're looking at that though, Kathy, there was one question in chat regarding the revalidation.
For sure, go ahead.
Okay, that question came in from Jeff Eisman. It says regarding Medicaid provider revalidation requirements, did the federal OB3 bill include any additional requirements here? Asking this since state Medicaid fraud, waste, and abuse is a stated goal and focus of the legislation. Now, my great OLTL staff have exited from the presentation. So what I'll say in response, Jeff, is that whenever there's federal legislation that comes out and it does impact the Medicaid program, it is part of the responsibility of all of our providers to review and familiarize themselves with the federal regulations that do impact the Medicaid program, because participating in the Medicaid program is assuming the responsibility of ensuring that you review, read, understand, and follow all the federal regulations that do impact you. In the waiver standards, in the waiver language, in the PA code, it does specifically state that all of our providers are required to follow federal regulations. So that includes following up on their updates. And, you know, I'll highlight here, there's a lot of great trade associations out there that provide a lot of great information and summary information for providers. There's a lot of materials out there, and there's also the approximately, you know, several hundred pages long actual legislation that could be read. So yes, there are changes related to the federal regulation. There aren't specific changes to the OLTL process, but folks would, it would behoove folks to evaluate those federal regulations as it relates to them updating their policies and procedures. So I hope that helps answer that question. Sorry, Kathy, back to you.
Thank you. Are we able to unmute the audience member?
Kathy, can you hear me?
Yes, go ahead. The floor is yours.
Thank you. This is Mia Gainey from the Pennsylvania Home Care Association. Thank you all for the presentations today. This question is particularly for Secretary Marsala. I was referencing HR 1 and the fact that there's a new commitment of dollars for rural health funding. They're calling it the Rural Health Transformation Fund. And while that is assumed to be mostly hospital focused, it's actually written in a way that can apply to a wide range of provider types, including home care. And I was wondering if DHS or OLTL has looked into that as an option for funding.
Yes, thank you for your question, Mia. Yeah, DHS is very familiar with that funding. Karen Rhodes is a special assistant for the secretary in the secretary's office with a focus on rural healthcare and its entire ecosystem, not just hospitals. So she is the lead in evaluating that and those considerations, specifically for the broader DHS and all of our services and offices. Would be happy to connect you directly with her if you'd like, and can bring that information out in a follow-up. Department of Human Services has been holding rural healthcare summits across the Commonwealth under Karen's direction and in partnership with the Department of Aging and the Department of Health. So there is considerable work going on with regards to rural healthcare and the entire ecosystem. So certainly being plugged into that work, I think, would be very beneficial. I hope that helps.
That would be great. You can give me your contact information. I'd appreciate it.
Thank you. It looks like we have another hand raised. I don't know if that person can unmute and ask your question or provide your comment.
This is the Carol. Julia, I was wondering, and I've been wondering about this for a while. I have Medicaid, and I was wondering when I don't get my services because I'm the 24-hour care. Where did that money go?
So if I'm hearing you correctly, Carol, you're asking, because you're on Medicaid, when you don't get your services, where does that funding or that money go?
Yep.
Okay. So with regard to the Medicaid program, I'll speak to our largest Community Health Choices program. The Community Health Choices program is a capitated fee based on per member per month that is paid out to the managed care organizations. So in that program, if services aren't rendered, that money does not come back to the state. It's part of that capitation. Folks may then go, well, isn't it in the best interest for the MCOs not to provide services? That's not the case for several reasons. One, CHC MCOs are held to service level agreements to high performance measures and expectations. They don't do well with us, there's consequences and repercussions. The other thing is if they don't do well by the participants that they serve, those participants typically have higher medical costs, right? If they wind up going to the emergency room, then those services will cost the MCOs more. So under CHC MCOs, that money stays within the capitation rate of the managed care organization because they're charged with providing that whole person care and services. Under the fee-for-services program, if someone does not receive services, that funding remains in that line that is allocated for that budget year. And I can guarantee you that OLTL is not inclined to give money back. We are inclined to spend every possible dollar allocated to us to increase and improve the services for Pennsylvanians, which is why you've heard me say with regards to the ARPA funding, my provider friends, if you have not submitted your reports, they are past due, and I do not want to give any of that money back if it was appropriately spent. So I hope that helps, Carol.
Yeah, no.
Thank you, Carol and Juliet. Can the person be unmuted that's in the general audience that has their hand up?
It's Matt Seeley that has his hand up, Kathy.
Oh, okay. Go ahead, Matt.
Oh, okay. You said the audience. The question for Juliet, real quick. If and when a budget does pass, can we spend an entire meeting discussing the potential impact? Well, I don't want to say potential. The impacts on DHS programs and services.
Sure. Matt, when the budget comes out, myself and Dan usually go through the budget. We can certainly ensure there's ample time to kind of walk through it.
I'm trying to like cancel like any kind of presentations or anything like that. Let's just talk about this.
Absolutely.
This is Kathy. We do have that on our agenda requests, Matt, for when the budget is released. So anything you want to add, and again, we will allow time.
If it needs a motion, that's fine. I'll make a motion.
No, it doesn't need a motion. I'm just trying to say that we are planning for that.
All right, we're going to erase the all the stuff on the agenda and just talk about this.
Okay. Great. Are there other questions, comments from the room?
Michael Greer has a comment.
Go ahead, Michael.
Thank you guys for the folks that did the presentation.
Carol, can you mute yourself? We can't hear Mike. Thank you. Go ahead.
Thank you guys for the presentations today. Nathan, I was wondering, could we add the sills to your distribution list of the locations that you put out?
Yes, I can. Oh, yeah, we can look into. So we had the original print shipment. We were trying to spend the money, similar to, so we had that print shipment go out pretty quickly. But we're looking into. I also could have mentioned this. We're looking into a grant with an ACL grant with the University of Pittsburgh to evaluate the care kit in practice, especially with people with disabilities. And I think that would be, and with community health workers and things like that. And I think that would be a great something we put in our proposal was more funding for printed items and things like that. So yeah, I think that's possible.
Nathan, did you mention that the publication is going out to your ADRC partners?
So it'll be going out to the area agencies on aging, and we're encouraging them to share it with people around. It was mostly about shipping and the logistics of that. So we're encouraging, if you want to go to a AAA that you work with, say, hey, the department will have a bunch of boxes. So if anyone wants one of those too.
So Michael, the majority of SILs are core partners with the ADRCs, and as you know, that goes kind of coordinated through the AAAs. So I would hope and expect that the AAAs would be pushing that out to their core partners, the SILs, but we can certainly follow up, as Nathan said, to make sure that's happening, because all the SILs, I don't recall a SIL that isn't connected with the PA link and the ADRCs. So good point. No other questions from committee members in the room.
Thank you. Are there any other questions from the room from anyone else?
I don't see anyone indicating wanting to come up for public comment.
Thank you. Any other comments from members before we move to the general remote audience? Okay. It looks like there's
Jeff from PASIL. Can you hear me?
Yeah, we can hear you.
Yeah. In terms of the state budget, the current delay, are there any impacts right now? And if not, will there be any impacts if this continues through August? Just OLTL programs specifically, home and community-based service programs. Thanks.
Thank you, Jeff, for that question. So the long-term care appropriations is a mandatory appropriations that will be paid out. The Medicaid programs are mandated programs to be paid out. So the Office of Long-Term Living does not anticipate impacts to any of our Medicaid programs or our long-term care programs. The Department of Human Services will pay out everything that it's legally required to. So that's kind of where that line is. It may impact, generally speaking, predominantly more grants, but anyone who's impacted with the Office of Long-Term Living should or will be getting those notices if they're under a grant and that grant has an impact. But I don't anticipate much impact to our programs. So Medicaid providers will get paid, Act 150 will get paid, OBRA will get paid, Life should get paid. So I hope that helps, Jeff.
Yes, thank you.
Thank you. Is there any questions in the chat or comments?
There are. I can go through them. One is related to the revalidation. Can an agency have one service location for the entire state? If they have one service location, that would be for it. But if they have several service locations or physical locations, each of those physical locations has its own service location. You have a master provider number, and Matthew's going to come up and give you more of the nitty-gritty and keep me honest.
Yes, just quickly, I know it can be.
Thank you. Yeah, I know it can be confusing with HCBS services, what constitutes a service location, because in general, you're not actually providing services at the service location that's registered with OLTL. The standard that we generally use is if you're keeping participant files or you're coordinating services out of a location, then it needs to be registered as a service location. If it is just an administrative office, or something like that that has no role in coordinating services, you're not storing participant files there, then that does not need to be registered as a service location. If you kind of feel like you're in the gray area, you're not kind of sure, then I'd recommend submitting the information about the service location or the question or the area or the circumstance in question to the RA account. Either I, Megan, or Kim will review that and determine whether or not that needs to be registered as a service location, and we will provide supporting information of why that does need to be registered. So if you do have a question, or if you're not sure one way or the other, it's best to ask instead of trying to make that determination on your own, because it sometimes it is not quite as black and white with the HCBS services.
Thank you, Matthew. Say that, just kidding. All right, Anthony House has submitted a comment thanking us all for our continuing fight, for the good fight for Medicaid and care for our citizens. The comment is that he is hoping DHS will issue some templated information and communication for managed care organizations, et cetera, to share to inform current Medicaid recipients about those changes. So thank you for that comment. I know you had to leave. Through. I think that was all the questions looking up for us from the chat. Oh, wait, there's another one. Sorry. Ashley Rake asked, do we have a breakdown of potential increases to the number of staff and costs by offices within DHS? With regards to the, I'm going to say I think that may be referring to my opening kind of comments regarding HR 1 and OB 3 and the state budget. And the answer is no, those are estimates. We do not have a breakdown by staff or cost by offices at this point in time. The way the budget works, we put requests in for additional resources. They are then allocated by the General Assembly. So we do not have those specifics at this time. Please bear with me, just trying to make sure.
I would like to comment quickly again, going back to the question that had been previously asked about the service location. If I could add to that really quickly. If you do register one service location for the entire state and you want to add every county in the state, the enrollment staff are likely going to ask you for an organizational chart so they can verify that you have the staff throughout the state to provide services to all the counties that are selected. Because if your service location is in Erie and all your staff are in Erie, it doesn't make sense if you're providing services in Philadelphia on a daily basis. So I did just want to add that quickly. I apologize.
No, that's a great addition, particularly when folks are thinking about teleservices in the future. Just want to remind folks that teleservices is at the option of the participant. So if you're trying to design a provider service location and you're saying, oh, well, I just 100% do teleservices, you might want to go back and look at that service definition about your requirements and obligations to providing those services, because teleservices and that option is choice of the participant, and every provider is required to be able to provide that service in person at request based on the service definition. I want to highlight that for folks as they're thinking about the future enrollment in that. Did have another question or comment from Alexandra Krishik. Sorry if I got your name wrong. Please provide a comment on House Bill 1549, which raises the minimum wage, and offer guidance on how we should respond given our current reimbursement rates. So I can't give you guidance on how you should respond with regards to your current situation. OLTL, and many of you know through that study, recognizes that there's a need to pay direct care workers a living wage. The governor, as part of his proposed budget, put forward raising the minimum wage. Pennsylvania is one of the few states left that has not raised the minimum wage. So my comment would be the administration very much would like to see a minimum wage increase across the Commonwealth. But again, those are the budget discussions between our representatives and the administration, and those discussions are ongoing. And I think that was the final question in chat for today.
This is Kathy. Thanks, Julie. Are there any other questions from folks in the room or comments? And how about our members joining remotely? Any additional questions or comments?
Yes, I have one. This is Juanita Gray. How are you?
Good, Juanita. The floor is yours.
Thank you, Kathy, and members, fellow members and audience. I was at a question I had asked this some time ago regarding implementing a program for college for the participants and as well as the direct care workers. Since Act 150 is in jeopardy of being having cuts made to it, would they consider having these implementations put in so that there can be other avenues for each individual to help with their better care and livelihood?
Juanita, you were cutting in and out for me. I'm sorry to ask if you could repeat yourself with regards to the Act 150 program and the care. I didn't quite get the full question. You were kind of going in and out.
I'm so sorry. Problems with can that college, I can't really hear it much either. I hear a lot of movement. Sorry. I was asking about the college program being implemented so that it can help offset if there is any cut regarding the Act 150, and for the participants that want to participate and help educating themselves, and the direct care workers as well, being another tool, to help benefit the program in overall.
Let me see if I understood the question. I think you're still going in and out for me. Were you inquiring about providing college benefits and pathways for direct care workers?
Yes, and also participants that want to be a part of it instead of the workforce, they should be able to get educated as well. I was talking about for both, because that would be a benefit to the services in overall.
Okay, so with regards to participants and sort of pathways to post-secondary college and training, the first recommendation I would have is for individuals to connect with the Office of Vocational Rehabilitation and their counselors, because you can get employment sort of supports in the waiver program, but it's a pay or last resort. So my recommendation would be to connect with the Office of Vocational Rehabilitation, connect with their great, certified rehab counselors and other team members, because they would help work one-on-one with individuals regarding any of their vocational sort of needs and goals and things of that nature, which could include sort of support in developing the goal and the plan to access the college, post-secondary education and training. They are kind of the experts with the Department of Labor, so that would be my recommendation. I mean, of note, the Office of Vocational Rehabilitation currently has an order of selection. So they do have a waiting list for individuals in various categories of need, but the most significant category of need, that's their sort of priority one category, does cover all of our NFCE LTSS folks. It is most likely that our long-term services and supports folks would fit the definition of the Office of Vocational Rehabilitation's priority one definition. So that would be my recommendation, Juanita. All right, Kathy, I see no other questions here in the room.
Thank you. Any other questions from members joining remotely for comments? Okay, well, I'll just, before we do a last sweep, to be sure, since we do have time left, I do want to mention that we will be meeting again on Wednesday, September 3rd from 10 to 1, both via webinar and in person. With that, I'll just do a double check again, since there's time left, to make sure there's nothing in the chat or in the room or from people joining remotely that want to make a comment or have a question before we adjourn. Okay, and there's nothing in the chat, nothing further. We've cleared the chat.
Nothing further for the LTSS subcommittee.
Okay. All right. Well, I think with that, then, unless unless someone wants to chime in quickly, I think we can adjourn. I want to thank everyone for joining today, and I hope you can all join us again on September 3rd. Thank you.
Thank you, Kathy.
Thank you.
Hi.